7 News on your side has reported for years on the widespread impacts of the lack of access to food across the DMV. Recent data shows roughly 36% of local people are struggling to get enough food, let alone high-quality produce.
For the past few months, our Jay Korf has been working on an exclusive story about a unique partnership that's improving the health of countless families in our region by treating food as medicine.
The rolling valleys of Virginia's Piedmont region, lined with orchards of Honeycrisp and garlic, serve as a breathtaking backdrop to a potential turning point in how our nation feeds and improves the lives of those in need. 7 News has learned that a select group of 200 farmers are collaborating with food distribution hub 4P Foods in Warrenton.
Like, how do we support farmers and how do we feed everybody?
And with Children's National Hospital in Washington, D.C.
It's an all-hands-on-deck approach. It really has to be.
To fundamentally improve how we grow and provide fresh, nutrient-dense produce to enhance the health of our most vulnerable neighbors.
The need is really deep.
The concept? Treating food as medicine.
Thank you for the free food, and I'm grateful.
Hi, everybody. Hello. Good to see you all again.
During every checkup at a Children's National Clinic in the DMV,
And I'm going to listen to your lungs, all right?
physicians like Dr. Qadira Ali
Big breath in.
screen families for food insecurity, along with their risk for a growing societal ill, diet-related chronic diseases like diabetes and obesity. In fact, the region's 2025 hunger report shows that more than 100,000 children in the DMV do not have consistent access to enough food, let alone healthy options.
It's staggering. It really, truly is staggering.
So a couple of years back, Children's National, with Dr. Ali at the helm, kick-started the Family Lifestyle Produce Prescription Intervention Program, or FLIP-RX. Here's how it works. Doctors identify families, 620 already, with diet-related health challenges and prescribe them 6 months of fresh produce.
Okay, yeah, I got it, thanks. And today I am jumping in to help pack produce bags.
Selected by Grace Groton at 4P Foods.
Apples, Asian pears, acorns, squash, garlic, collards, sweet potatoes, and I think that's it. And carrots. I look for good quality, I look for seasonality, I look for things that people are gonna like.
It was kind of difficult to eat the right foods or get the right foods per se.
Monifa Smith and her daughter, both diabetics, are successful graduates of the FLIP-RX program. Their blood sugar levels dropping precipitously.
And if I can't say it, I really shouldn't be eating it.
I always say our job is to be the gasoline to fuel the good work.
Marriott Foundation CEO Mika Wick
So if you care about outcomes,
partnered with Children's National back in 2024 to ensure, with a $3 million investment, that this program will run through 2027.
so when we feed people's bodies, we provide them the supports they need to get well and feel well, we know they're on a path to solving for a lot of other challenges in their lives.
Yeah, what was your favorite page? Did you have a favorite page?
Wick says if their calculations are right, data collected from this program could improve health outcomes for countless Americans.
And over time, there's an opportunity to look at patient populations with very specific diseases and track the impact of healthy produce and healthier groceries on their disease vector. And we're very interested in that longitudinal data.
Marriott's money goes in part to the farmers who provide high-quality produce and to 4P Food staff in Fauquier County, who organize and hand-deliver bags overflowing with wholesome food to presently 150 DMV families.
We will deliver food to their front door, and they get wrapped with services in the form of recipe ideas, preparation tips, cooking classes, to make healthy eating easy and the norm instead of the exception.
Yeah, I got a lot of deliveries. It's a long day, but I'm doing what makes me happy, making sure everybody gets the proper food that they need for the week.
We followed driver Lamont Vernon as he hand-delivered a week's worth of produce to front porches across the region.
We know this is life-altering. We know this is life-altering for children.
Our final stop of the day, revealing the impact of this program for Altagracia Ramirez
Well, we got a little bit of carrot.
and her sons Jose and Ronaldo.
And this is some good quality food, especially fruits and vegetables. So, like, it means a lot. It's healthy. It tastes good. You want some?
Yeah, just fascinating. And Jay and I were talking about this a couple weeks ago. You were previewing the story for me, talking about how great it's going to be. Really interesting. The question now, as Jay joins us here in studio, is are there any real indications about the positive health outcomes from all of this?
Yeah, so the data is going to take a couple more years, and then things are going to blow up. I mean, this could really have a massive impact all across America. We are certainly hoping. They're looking at some charts, some preliminary numbers, and everything is looking great. I mean, consistently lower blood pressure, lower BMI, lower A1C, which is your glucose levels for people who are diabetic. So they are really seeing some really exciting stuff, and that's why Marriott got involved, because they did this project a few years back. They collected some data, they went to Marriott. Marriott said, wow, this could be huge.
They saw the potential there, and
Yeah.
you talk about the immediate impacts there, which are obviously notable, but what are some of the possible longer term ones?
Well, think about changing the template. You know, we're in this mess in the first place because, unfortunately, those who tend to struggle financially, they're going to buy shelf-stable food. They're going to buy stuff that's going to last, it's going to be affordable, it's typically delicious, but unfortunately, as we know, shelf-stable food has a lot of ultra-processed stuff in it. It's just not good for you. So the hope is that we can get away from that and we can move more toward people just eating food from the earth.
Now, there's a financial aspect to all of this. Families have budgets. How does that all come into play?
Yeah, so it's great because if you get $50, $75, $100 in free produce and you don't have a lot of money, I mean, think where you can put that. Put that $300, $400 a month into things that you really need, maybe preventative medicine, your rent, your utilities. But I think really at the end of the day, what's so exciting about this is that if this works, if this data works, you could have entire states, the country, you could have more foundations getting involved in this, you could have entire healthcare systems that are really pushing nutrition as preventative medicine. And I mean, this could arguably change the lives of millions of people.
Yeah, can't wait to see how this plays out, but really appreciate you bringing this one forward for people to see. Really nice, Jay.